I am Dr. Praveen Ankati, Senior Consultant Neurosurgeon at Global Hospital, especially do deep brain stimulation for Parkinson surgery. This is called functional neurosurgery. The advent of the deep brain stimulation and advancement came from 19s onwards. Initially the patients were suffering significantly, so they were treated initially with the legionectomy and destroying small part of the brain. It is globus pallidus interna, subthalamic nucleus and thalamic limb. So these part being destroyed partly so that they will have improvement. But the problem is, if we can do surgery on only one side, if you do surgery on both sides, they cannot walk, end up in quadriparesis, means total paralysis of body. So it is difficult. So slowly the improvements has come. The initially legionectomy being done, followed by medication, levodopa therapy. In comes to the 1990s, initially 1930 legionectomy, 50s levodopa, 1990s the deep brain stimulation, high frequency stimulation of the brain has come. The same high frequency stimulation was giving the improvement to the patient and less damaging the patient, almost nil damaging the part of the brain. So in 1990 all over the world just initially started. In India it started picked up slowly from 2000 onwards. It was very slow till 2005, 2006. Later part they picked up very well in centers like in Hyderabad, Nimhans, Bangalore, Trivandrum and Bombay and Delhi. So these are areas gradually progress. Now it is being done as a routine surgery for these Parkinson patients. In Parkinson's disease, we should know that primarily is it Parkinson disease or Parkinson plus syndrome. So we have to differentiate between these two before doing any surgery. Why? Because if you do surgery for Parkinson plus, they don't respond well and slowly they will go down. In Parkinson syndrome, initially the idiopathic Parkinson syndrome, they initially respond very well to the levodopa and other drugs. Slowly after 3-4 years, it starts gradually wean off the effect. So develops dyskinesis and bradykinesia, akinesia. Severe problems start coming after 4 to 5 years. So they end up in the disability stage at the end of 7 years, 8 years. So whenever the patient not responding to the levodopa, the duration of the effect goes down, and also the appearance of the increasing of dyskinesias is the stage for the surgery. Now universally almost 4 to 5 years is the minimum time for the medication. So after that 5 years, 4 to 5 years, surgery is usually required to these patients for the improvement. In this surgery, it is a functional surgery. So in this we don't damage any part of the brain. So usually 2 out of 100 cases had small problems. Usually death risk is almost nil. Only 2 out of 100 will have some weakness. Major problem may not be happen in this patient. So the safety of the surgery is very high, and also the risks are there. Infection can be there. So that is 4 to 5%. That is only risk we have. But in case of risk, we can give antibiotics and remove and replant the lead so that it can be covered off. If you do surgery, so the lead, whatever you place in the brain, it stimulates the brain and it increases the on phase, that is called on phase of the drugs. So without drugs also they will be in on phase, so that the duration of the well-being will be better and quality of the life will be better. The average improvement all over the world approximately to 50 to 70%. Sometimes they may improve above 70%, but they never improve to the normal because the degeneration process goes on. But average it is more than 50 to 60%. Definitely the daily living activities comes down, and tremor shaking it will improve, and also the gait, bradykinesia. So whatever they have these problems because of the dyskinesis will come down, gait, bradykinesia will improve, and also the activity of daily living and body pains also will come down significantly. suggestion at present all over the world says that if Parkinson disease is there, after 4 to 5 years, if they start losing the response to the medication, now it is mandatory or recommended, apart from along with medication, the surgery is required. So all the patient with medication and surgery, they will be far better than only medication. So it is always, if you have a Parkinson, better to undergo surgery. It will be give additional effect including medicines. So they will be better off, and the progression of the disease may come down, but it is not sure, but symptomatically they will have significant improvement. In the neurosurgery at present, there is 90s onwards, 2000 onwards, there are a lot of advancement in the technology of microscopes, navigations and drills. So because of this and hemostasis, the quality of the surgery has gone tremendously increased, and also the using of intraoperative navigation, intraoperative MRIs, all these have helped in the outcome of the patient. At present, even major cases, the risks of the surgery is less than 4% compared to previously. So it is almost safe, the procedure, because of the advancement of the technology and understanding of the disease and exposure to the training.